Hey there, friends. It's Dr. Russ. I'm a chiropractor in Portland, Oregon. I do lots of myofascial work, and this video is about what is the secret. How do we do this? It looks so gentle. It looks like nothing's happening, but people feel better, and tension is released, and pain dissipates, and circulation is improved. And this all started with, well, I wouldn't say it all started. I've been doing this a long time, but the idea for this series of videos started with an email from Timothy. And in part one, I read his first email, and I tried to give a really thorough but not too meandering response to it. And now we're going to talk about Timothy's next email and hopefully address a little bit more. So my goal in life right now, one of my goals is to try to create something that is maybe something like a step-by-step guide to doing good, gentle myofascial work that's really effective. I have not yet been able to do it, and I'm hoping that by sharing this thought process with you through the magic of YouTube, that I'll be able to distill this in my mind as well and come up with a way to communicate what I'm doing. And a lot of what I'm doing is intuitive, and a lot of what I'm doing is based on the experience that I've had. And those things can't be replicated. The only way for anyone else to have experience is by doing it. And the only way for someone else to anyone to develop their intuition is by working with it and trusting it. And a big part of what we're doing is palpating and listening with our hands and observing with our eyes and ears how the patient responds to our touch and how their body responds to being moved and pressed and stretched in certain ways. So there's a certain amount of receptivity that goes into that, and a certain amount of trial and error. And 50% of trial and error is error, probably more than 50%. A certain amount of intuition and a lot of trust. And one of the nice things about working gently is I'm really confident that I'm not going to hurt anybody. And so I feel very confident in working with basically anybody that walks through the door. There are occasionally people that I say, before I've even touched them, I don't think that we should try this, for various reasons, which we can get into in another video. But myofascial work is very forgiving, and the body will be very forgiving. It's not aggressive, and you're really working with the body. So let's take a minute here. I just want to say hello and thank you for watching. And if you're a new viewer, I welcome you. And if you're a returning viewer, of course, it's nice to see you as well. Okay, so I had responded to Timothy's first email, which is in video part one of this series, thanking him, affirming that I think he's on the right track. And yeah, if you're in a spa or spa adjacent setting, you have a certain clientele who have certain expectations. And, part of business is delivering on your customers' expectations, and part of business is helping people understand that what they think they want might not really be the best thing for them. I had this experience when I was piano shopping about 15 years ago. Business was good, and I always wanted a piano, so I couldn't afford a new one, and I went to the piano store, and I said, I want a used piano. And she said, okay, I hear that you want a used piano, and I will show you the used pianos, but I also want you to know that for the price of a kind of old, beat-up used piano, you can get a really, really nice digital piano. I was like, I don't want a digital piano. She goes, I know you don't want one, but I just want you to look at them. Would you look at them for me? So I looked at them, and that's what I bought. And I still have it, and I love it. It's not the same as a regular acoustic piano, but it is really quite good. So anyway, she did a really good job of help me understand what was really going to work for me. So Timothy is asking himself, is this the best way? Knuckles and elbows and trying to pound people's tissue into submission, seeking resources and knowledge and seeking it from me. I'm honored and flattered. And, my answer is anatomy is so important. Physiology, understanding fascia, especially the superficial fascia. I know I'm saying this all really blithely. Travell and Simons, the Trigger Point Manual. David Schleip, he is the current fascial, like, amazing research guy. John Upledger, Craniosacral Therapy, his chapter on palpation skill did amazing things for my ability to feel things in people's bodies. Leon Chaitow, Chaitow. I don't even know how many books he wrote, but he really took neuromuscular therapy to the next level in terms of publication. He's got a lot of really good books that explain the physiological effects of different types of touch. So understanding how your pressure, depth, direction, timing, all those things affects the nervous system, affects the local circulation. So these are the sorts of things that I am recommending. So I had emailed Timothy, and here's his second email to me. He says, "Thank you. It was helpful. You're welcome. I'll study all those things that you mentioned." Cool. I hope you do. I'll put all those things, by the way, in this video description along with my contact link. If you have any questions, you can drop them in the comments section of this video or reach out to me directly. If you drop it in the comments section of this video, YouTube likes that, and then they'll recommend this video to more people. So I appreciate that. Just a comment is really helpful to me. Timothy says, "It's not so much about the videos, like my treatment videos, I watched from you, because the technique seems constant throughout all of them. You touch someone lightly and the problem is either not a problem anymore or it's better. I have been so confused about how that works. I've been trying to replicate it on my clients and it's hit or miss." Yes, it is hit or miss. It's trial and error. 50% of it is error. And so that's not a bad thing. That's not you doing it wrong, or it's not working for you. You're not in the right place. If you feel a tense muscle and you stretch it and knead it and offer it some stimulation and give it an opportunity to relax and it doesn't, that's not on you. It's not on them either. It's just not what it needs. Lighten up. Feel the fascia, the superficial fascia overlying it. We find so many restrictions in that space between the superficial and the deep fascia. So it's like skin, superficial fascia where the adipose lives, and then that deep fascial layer, that's like the silver skin that you see on meat. And then there's the muscle, and that layer between the superficial and the deep fascia is where so much tension gets held and restriction happens. And then the muscle underneath it's just responding to that. And so if you're just squeezing the muscle or just pressing the muscle, you've gone right past that restriction. So there's like a little bit of a pinch and a lift and work that superficial fascia under your fingers. And a lot of times you'll feel the muscle underneath that just let go. And if you don't, maybe you're using too much pressure, or maybe you're going too fast, but also maybe you're just not in the right place. There's an old saying, if you want to do what someone else is doing, do what they did to get there. And so practicing palpation, learning anatomy, understanding physiology, so that you know when you're touching someone, where you're touching them, you know what you're touching. And when you touch them a certain way, you have some idea of how that's going to be affecting them. And then, of course, any video that you watch me doing, any treatment that you're giving, 60, 70% of it is assessment. So I really feel like if I'm able to be precise with my location and my pressure, then I won't have to use as much force and it won't take as much time. My confusion is more just about how tissue responds to touch. How much pressure is required to make an improvement? Why you're able to hold a certain point and decrease hypertonicity, and when I do every single technique I've learned on that point, it doesn't budge. But if the subjects you recommended are key to what you do, I'll study them. And those are the things I talked about a minute ago. How much pressure is required to make an improvement, right? And so that's different for every person and every body part and every visit. So there is a sense, and again, we're coming back to the intuitive side of this. There is a sense of receptivity in the tissues. Some people call it rapport, 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 a connection. I don't know how else to describe it right now. I'll try and think of a better way. But it's like getting a yes, feeling it shift. Also very concrete things like feeling them take a deep breath, feeling their body relax. Also, you can ask. We forget we have a person on the table who is actually experiencing this treatment from the inside and can give us immediate feedback in the moment. Hey, does that feel right? Is that where am I on it? I ask people that a lot. Am I on it? Is that it right there? And a lot of times they'll say yeah, and sometimes they'll say no, it's a little bit higher, right? And then, oh, cool, that's really helpful. Maybe I don't show that enough on my video because I'm so keyed into talking to you, the viewer, while I'm doing the video treatment. But I do that with folks a lot. How is that? Does that feels like it to me? Am I on it? This feels like the center. In that craniosacral therapy book by John Upledger, there is that chapter on palpation skill. And one of the things he talks about is something he calls arcing, where you're sort of like moving the tissue gently and trying to find the physical hub and the physical center of the restriction. And that's usually where you want to be. You might feel their whole back is tense, and you can definitely give them a steamroll treatment. And some people will really like and appreciate that. I think a lot of people will. Or you can feel their fascia, and this only comes through practice. There is no shortcut. And kind of feel, where is it stuck? And then you get in there and then you find it. And then to you, watching me do this, it looks like I'm just like doing this, and then, oh, it lets go, and then their whole freaking back relaxes. It is amazing. It is a miracle, but it's not a secret. It's just my ability that has been gained over many years to sense where the restriction is. And that only comes with practice. So again, if the tissue isn't responding to your touch, I would say back off and open up the lens. Come out more superficial, release the pressure, and take a broader view. And let's say you are in the lumbar spine and you feel a restriction in the lumbar paraspinals, and you're like in there and you're digging, and it's just pushing back and it's not budging, as you say, okay, cool. You definitely gave that person's nervous system a good long look at this little knot and an opportunity to release it. And hopefully you've encouraged them to take some breaths into the area, and it's not budging. Well, back off. Where is this muscle going? Where's the origin insertion? Well, that thoracolumbar junction and that iliac crest, sacral base, that whole area where L4-5 meets the sacral base on the top of the iliac crest, where the iliolumbar ligament is, and the sacral fascia and the thoracolumbar fascia gets real thick and dense right there. Oh, people hold a lot of tension in there. It gets really restricted from all the sitting. And so then try working there. And don't forget, the skin and the superficial fascia are really just as important as anything else. And don't go straight for the psoas and straight for the piriformis. Those are super important structures, of course. But there's a lot of layers in between. So open the lens, look farther up and down the chain, and really just be listening with your hands. If you feel something is restricted and tight, trust that. Trust that that's what it is, and see what happens if you start to mobilize it. See what happens if you start to lift it. See what happens if you start to stretch it. See what happens if you start to give it a little pinch. The nervous system, for most people, unless they're really super duper frozen up or their tissues are really deconditioned and dry and degenerative, the nervous system will respond really quickly. He says, I understand if it's not something you're interested in doing, but I think many therapists would appreciate you explaining how what you do works. I'm so interested. I would love to. I'm sure there are people out here on the YouTube already doing so, but either I haven't seen them or the explanations are a bit convoluted. but you explaining the science of well-placed soft touch during your ASMR sessions would be game-changing. Just a hope of mine. Either way, you give me much to look into, and I'm grateful for that. You seem like a really nice person. I have to wonder, how did you get to the skill level you're at? Was your schooling similar to mine, or was it precision-based? There's a lot in there. I'm going to try to explain what I do. I think at times it might be convoluted. I'm going to ask for your forgiveness on that. But I don't know who's going to get what. So I'm going to just keep trying. And I would love your feedback, any viewer at all, again, in the comments section. Questions. What do you want to see? I cannot promise that I will be able to deliver these at any particular pace, but I'm trying anyway. How did I get to the skill level I'm at? I was not born this way. So I talked about my schooling in part 1 of this video. I'll give it a real sort of a quick overview again right now. I did shiatsu massage first. And so I was young. I was 24, 23 when I did that. Oh my gosh, so young. And so I started touching people at a young age, and that taught me not only some massage technique, but I also got my basics of anatomy, and I also got a holistic perspective, because shiatsu is based on Chinese medicine, which is based on the meridian system, which is based on energy, treating the body like a garden and not a machine. And so I entered chiropractic school already with that point of view. And then in chiro school, of course, I, like you, Timothy, just like dove in. I was so excited to be in school. I couldn't wait to learn about cellular metabolism and all the things. And I applied myself really hard. And I'm proud of that. But also I recognize that that represents a lot of luck and good fortune that came my way, that I didn't have to work during that time. I was able to really just focus on the schooling. I read John Upledger's craniosacral therapy. I practice craniosacral therapy, which will develop a sensitivity in your palpation that I don't think can be matched by any other technique. I studied applied kinesiology, which I don't do anymore, but taught me a lot about how the nervous system and the muscular system work together. And then I studied neuromuscular therapy through Leon Chaitow. And as I said before, I was a knuckle and elbow guy for a while. So I did a lot of that. But it's really a lot about longevity. So the time that I have been in practice is really the main thing. And just doing it and doing it and doing it, even those times when I didn't want to, because I had a lease and I have my expenses, and this is what I needed to do to make a living. And I didn't really have any other option. So I love it. But there have been times when I haven't, and I stuck with it anyway. And so it's a lot about just touching people, palpate as many people as you can. Everybody who comes into your clinic is there for themselves. They have something they need doing, but they're also there for you, an opportunity for you to learn from their body. And so is there a type of school that specializes in this? No, not that I know of. Or training for people who want to be a hybrid of LMT and chiropractors. There is, but I haven't found one yet that has really suited me. I'm thinking about straddling both of those lanes one day, which is very cool. But I want to gain more experience with massage first, because it's such a big world. You are right, it is. And there is so much that you can do. With an LMT license, there's so much you can do. If I was starting out today as a 25-year-old and I had the choice between going into, I don't know how much debt to do a chiro education anymore, because it's not just the tuition that's gone up, but of course all your living expenses now are so great. Or going to massage school, which would be way faster and way cheaper, I'd have to think really hard about what I'd want to do. When I think about the things that I do day by day, honestly, I think 85% of what I do, I could do under a massage license. Certainly I couldn't diagnose or refer for images. There's some physical therapy modalities that I use that I wouldn't be able to use. and of course the adjusting, the manipulation. So those things are an important part of my practice, but there's so much you can do as an LMT if you're willing to. Another thing you might want to look into is active release technique. I took some of their seminars, and they're very precise with their anatomy. They're really insistent on you knowing where you're working and what you're doing. Their protocols don't work so great for me and my hands, but they work really well for a lot of providers. And there are a lot of patients out there who are seeking ART in particular. So that's another possibility for you. So I'm going to sort of wrap it up by saying thanks for watching. And I hope that you do like this video. And I appreciate your attention. Just to mention, if you're still listening, I appreciate subscribes and likes and shares, comments. That all really helps me. You can also leave a tip in the thanks button, and you can become a channel member where you would have access to some exclusive videos, and that money, that's directly to me and supporting what I'm doing. It's $3 a month. So if you want to do that, I appreciate it. Otherwise, if not, that's totally fine. Full disclosure, I'm not a member of anyone's channel on YouTube, but that option is there for you if you want. So this is Dr. Russ in Portland, thanking you and hoping that I get lots of questions for you and from you, so that I understand where to take this and how to explain what I'm trying to do. And if you're new to my channel and you're interested in the kind of work that I'm doing, I have a bunch, I don't know how many, dozens of videos of me demonstrating treatment that I recommend you watch and see if you can learn from and see if it raises any questions for you. You can drop a question in the comment section of any video. I read every comment, and I try to reply. I try to respond to everyone as well, because I appreciate your time and your views. So from late November, Portland, gloomy day, this is Dr. Russ once again saying thanks for watching. We'll talk again soon.